Monkeypox, now officially called Mpox, is a rare viral disease that causes a rash and flu-like symptoms. It is caused by the monkeypox virus, a member of the orthopoxvirus genus, which also includes the virus that causes smallpox. Symptoms of Mpox. After exposure to the virus, it can take several days to a few weeks for symptoms to appear. Common symptoms include fever, rash, swollen lymph nodes, chills, headache, muscle aches, fatigue. The rash typically starts as flat, red bumps that can be painful. These bumps turn into blisters which fill with pus. Eventually, the blisters crust over and fall off. The entire process can last 2 to 4 weeks. How Mpox spreads. Mpox spreads through close contact with an infected person or animal. Person-to-person spread occurs through contact with the sores, scabs, respiratory droplets, or oral fluids of an infected person. This usually happens through close, intimate situations like cuddling, kissing, or sex. Animal-to-person transmission can occur through broken skin, such as from bites or scratches, or through direct contact with an infected animal's blood, bodily fluids, or pox lesions. Contact with contaminated materials such as clothing, bedding, and other linens used by an infected person or animal can also transmit the virus. Diagnosis and treatment. Mpox is usually a self-limited disease, meaning it gets better on its own within 2 to 4 weeks. However, there are no currently approved antiviral treatments for Mpox. To diagnose Mpox, a healthcare provider will take a tissue sample from an open sore and send it to a lab for polymerase chain reaction testing. You may also need to give a blood sample to check for the Mpox virus or antibodies. Prevention. The best way to prevent Mpox is to avoid contact with infected animals and people. Vaccination can also help prevent infection. Vaccines developed for smallpox also provide protection against Mpox. These vaccines are currently only recommended for people who have been exposed to or are likely to be exposed to Mpox. Other ways to prevent Mpox include avoiding contact with infected animals, avoiding contact with bedding and other materials contaminated with the virus, thoroughly cooking all foods that contain animal meat or parts, washing your hands frequently with soap and water, avoiding contact with people who may be infected with the virus, practicing safe sex, including the use of condoms and dental dams, wearing a mask that covers your mouth and nose when around others, cleaning and disinfecting frequently touched surfaces, using personal protective equipment when caring for people infected with the virus. Key takeaways. Mpox is a rare viral disease that causes a rash and flu-like symptoms. It spreads through close contact with an infected person or animal. There are no currently approved antiviral treatments for Mpox, but the disease is usually self-limited. Vaccination can help prevent infection, and other prevention measures include avoiding contact with infected animals and people, practicing safe sex, and maintaining good hygiene.